maybe I need to tell you a bit more before I come to this one. Unfortunately, Gaza has been one of those contexts where the bombing has been indiscriminate. So it would mean that nobody is safe and nobody is spared. So the health workers, health facilities, ambulances are being targeted. Next to that, there has been on and off communication blackout. So it has been very difficult in such a context to get injured and wounded to the hospital. So every means, from people carrying people in their lap to using donkey carts to using cars, any means to bring patients to the hospital. And the hospitals are overflowing because the hospitals are not only used as places to treat patients, but they are also being used as shelters by local population because they have nowhere else to go. So in such a context where already there is a siege for water, fuel, electricity, in such a context when the supplies are extremely limited. So these are the trying conditions our teams are working on the ground. So there is a lot of humanity and there is a lot of helping each other that is happening because people are left with themselves. There's nobody else to help them. So people are helping each other. But at the end of the day, the fact of the matter is that there is nowhere safe in the country. So if you quote the context of Gaza, since 2019, we had a mental health program which was called Help for Helpers. It was mainly aimed at frontline workers to manage their stress levels and trauma they are facing on a day to day basis. So, this was meant to build up their resilience, to manage their overall well being, and to make sure that there is a way that they can express themselves and be able to continue as much as possible a normal life. However, since last 3 months, it is all about survival. So people are being asked to evacuate. So many of our staff members, many of the doctors have lost their homes, their family members. They are forced to make a very difficult choice between taking care of their families, moving them from north to south, or alternatively treating their patients. And sometimes treating patients when the supplies are really running low. Our doctors on the ground, our surgeons have amputated patients without anesthesia. So with bare minimum equipment that you could ever think about in terms of treatment of trauma. So that is what the teams are experiencing. They're experiencing moral distress. Imagine if you are put in a situation where you know that you have to go and look for water and bread for your family, and you have to be sure that you have left your family in the evening and in the morning they are still alive. There is no electricity. There is an evacuation order that they have to move from north to south or from middle of the Gaza to the southern part of Gaza. Doing that, and also your oath towards your patients that you would not abandon your patients, this adds a further layer of additional trauma for the frontline workers. Everywhere around the world, we treat people as people, patients as patients. So anyone who comes into any medical facility where MSF is operating, we will treat patients as patients. If you have ever seen any MSF facility around the world, there is a no guns policy. That means that anyone, even if he or she may be a combatant and must have been fighting, but the moment they enter the MSF premises, they have to leave their weapon outside. So it also goes back to our charter as an organization that we do not discriminate on caste, color, creed, religion, or any other denominator. For us, patient is a patient when they reach a medical facility, and we'll treat everybody. So our 52 years of existence means that we have developed expertise of working in conflicts, wars around the world. In every conflict, in every war around the world, we talk to all the warring parties. All the parties of the conflict we are in contact with. And the reason of our contact is to ask for safe access for our patients, for our health workers. So similarly, in the context of Gaza, we are in touch with all the parties of conflict and asking for them to respect our humanitarian space. Do not make health workers a target. Do not attack hospitals. Respect for international humanitarian law. That is what we are asking for. An immediate, sustained ceasefire. That is what we are asking for. Because we want to make sure our ability to treat is possible. Because as a medical humanitarian organization, we are meant to treat patients. We are meant to do our medical action. And we can only do it if our teams are able to do it. So that means we need supplies, we need safety of our workers. In the current context of Gaza, we are seeing, unfortunately, a disregard of the humanitarian space because we have lost 4 of our health workers. We are both witness and victim of the situation in Gaza. So our staff members have lost their family members. Only yesterday, as I narrated in the conversation earlier, one of our staff members lost their 5-year-old daughter. Few weeks back, somewhere in December, when we were evacuating our medical staff from north to south in a MSF convoy where all the vehicles were marked MSF, we could not manage to get them pass through the checkpoint, and unfortunately, the convoy was attacked. We lost again one staff member and a family member of another staff member. So, unfortunately, in this situation, we have seen now multiple times that there is very little or no respect. As per WHO statistics, more than 300 health workers and health facilities have been attacked, damaged, and targeted. So Gaza has been under a blockade since last 16 years. So whatever enters Gaza enters through 3 different checkpoints. Currently, out of these 3 checkpoints, the only checkpoint that is accessible is Rafah border, which was not meant or built in a manner to allow supplies entering into Gaza. So that is one big thing. The other aspect of it is because of indiscriminate bombing, all the roads that would help bring the supplies to the hospitals are damaged. The fuel supplies are not available, so that means there are no cars, no vehicles that will bring these supplies to the places that they are meant for. And the last bit of it is, irrespective of whatever we say, prior to October 7, the number of trucks that would pass into Gaza would be more than 2,000. We are now talking about a handful of trucks when the needs are massive and immense. Thank you for asking this question, because let me remind you of something we all experienced. When COVID happened, we saw all the attention, especially medical, be it resources, any solutions, all went for COVID. And everybody forgot that there is a world out there of diseases and illnesses that need attention. Same is the case for Gaza, that everybody is talking about the trauma, the burns, the injuries that are directly related to the war. But what happens to cancer patients? What happens to dialysis patients? What happens to uh, TB patients? What happens to when there is no safe drinking water? When people are forced to drink water that is saline water? What happens to when immunization is missed? Where do pregnant women go to deliver their babies? What happens to sanitary hygiene? Just imagine in a war where you cannot find water, bread, electricity, fuel. How are the girls looking for and finding sanitary napkins? We had in our clinics patients approaching us asking for family planning tablets just to delay periods because there is no water, or they are being forced out of their homes and they are living in these shelters where there is not sufficient showers. So what you have is like not only regular illnesses but possibilities of opportunistic infections, airborne, water-borne infections, that we are really fearing that there would be more deaths because of that than the conflict itself. So MSF is an organization made of doctors, nurses, paramedical staff, uh, health workers, not only, but also financial professionals, health professionals, logistics professionals. So we always look for such profiles around the world who can go and work in different locations. So to be able to work with us, please go to our website www.msfsouthasia.org and apply to be a part of our team. Remember, we are an organization that does treatment free of cost, but the hands that does that treatment are thoroughly scrutinized. So our recruitment process, our selection process is quite extensive. In many cases, it takes between 3 to 5 months. And it also depends on your profile, because if you are a dentist, we do not have dental projects. But if you're a HIV physician or a TB physician or a surgeon, yes, of course, because we work in conflicts. We work in locations where we have programs which are primary healthcare clinics, but also very advanced trauma, HIV, TB, gender-based violence, etc.